Hi, Steve here from Wandsworth Physiotherapy. I get asked all the time from my patients, what's the difference between physiotherapy, osteopathy and chiropractic? And here's what I tell my patients. People still incorrectly assume that osteopaths and chiropractors just treat spines and physios treat shoulders and knees, for example. But in reality, all three professions are trained to treat any problem of the musculoskeletal system, muscles, tendons, ligaments, joints. I think people probably do gravitate a little bit more towards osteopathy or chiropractic for backs, and physios work in the NHS or they work in sports, so they see a lot more sports injuries and do a lot more fracture rehab and surgical rehab, but we're all trained to be able to help you. Now, of the three professions, physiotherapy and osteopathy are probably more similar. We'll use spinal manipulation, perhaps some massage or even some acupuncture. And beyond these core skills, osteopaths might gravitate more towards manipulating your spine and looking at spinal alignment. And physios can do that, but they'll also give you exercises and try and empower you to do your exercises, get your problem better at home. Now, of the three professions, chiropractors are probably the most different. In your initial assessment, they'll probably x-ray your spine, gravitate towards manipulating your spine and correcting spinal alignment to free up nerve movement, and that's how they'll explain to you that they're getting your problem better. So we're all trained slightly differently. We'll give you a slightly different explanation as to what your problem is and use different techniques, but we're all working towards the same goal of getting you better. Now, I've had people come to me and say osteopathy or chiropractic doesn't work. I'm sure people have seen physios, seen me, myself, and said that physio doesn't work. But I don't think it's not the profession that's not working. I think it's probably just the interaction between the patient and the therapist. Perhaps there wasn't a connection there, or just perhaps that the beliefs and expectations weren't met for that patient. So, for example, if you feel that you need your neck manipulated, where you feel that crack sound when you have your neck treated, then perhaps you should go and see a chiropractor or an osteopath. If you don't like that, and you want some more massage or you want to be given exercises, then perhaps physio is more for you. So I hope that helps to distinguish what we do differently, what we do the same, and how we can help you, and hopefully just better informs you who to decide to go and see.